The Tema Fishing Processing Company can open for operations after first test of 624 workers came out negative. That's according to the head of disease surveillance, Dr. Franklin Asiedu-Bequim. He also says the Ghana Health Service has begun aggressive contact tracing for 7 workers who have tested positive in the company after an initial 695 of them came into contact with a COVID-19 patient, forcing the factory to shut down. This came up at the last press briefing a while ago.
The Tema one is about a factory. It's a fish processing factory that had an employee who presented with respiratory symptoms and was actually seen by the clinic in the facility. So they took samples and was asked to go home. And then after about more than a week, the results came. So when the results came, they actually identified her contacts. And then at that time, they had 219 contacts. So there was initial tests that were done. And then to get a broader view of what is happening in the factory, that has a population of about 1,300. They tested everybody in the factory. So what came out was that initially it was 533, but finally it was 693 that tested positive, 695 that tested positive in the facility. So the rest were negative. So what was our approach to handling this? And the idea was immediately the factory was closed down. And then it was assessed to look at the gaps that exist in such a facility. And one thing which was very obvious that for such a facility, you could see that the employees were much more than the space. That was one obvious thing. The other thing was that the social or physical distancing was a challenge. Then they also have issue about, they have a canteen, and you can see that social distancing is also being practiced in the canteen. So they have a table that 6 people sit on. So it tells you that there's so much closeness. They also have a bus that carries them around. And social distancing is also not practiced in that bus. Then they have what they call a turnstile. It's like before you enter the factory, you have to go through it. So it's an entity that can actually transmit infection among a group. So they also have a login system whereby you have to put your finger on. So those are all predisposing factors that can make you get the infection. So going forward, the idea is, how do we look at the situation in the factory? And then how do we manage the cases and the contacts? So let me say that as I speak today, for the 695 positive cases, the result that has come is that 624 are negative and only 7 are positive. So it tells you that 95% of the people who were positive are now negative. So now we are trying to move the 7 to our isolation center in Pentecost facility. But let me say that these are all asymptomatic persons. And what we are doing is that if you look at these 695 persons, they were scattered across Accra. So all of them don't live in Tema. So we have they living in Ashama, Lejokuku, and the rest. So what we've done is that we have reallocated them to their districts to identify the contacts and do the follow-up. So that's being done. But then we try to look at the factory. So what is being done at the factory? And we visited the factory to assess preventive measures put in place to avoid spread. And then what is very obvious is that hand washing facilities have been placed at the entrance of each section. So there's a conscious effort to ensure hand washing. Then they've tried to put floor markings. The idea is to ensure physical distance. So you can see where you are supposed to stand. So there's a factory. So they are telling you where to stand. You do not decide where to stand. They send their markings to ensure there's a physical presence, physical distance. Then all staff are wearing the face mask. Then hand sanitizers have been placed at all vantage points. Then the canteen that I said was a table that houses 6 people. Now they are housing 2. It will be recommended that it should be 3 because it can take 3. So they are ensuring physical distance now. And then they have created a holding room to handle a case of suspected COVID. So in that case, if you think that it could be a case, you usually move there before actions are taking place. Then they've also introduced a temperature check point at the entrance of the company. So in that perspective, we think that the factory is ready to start operations.